impurity which could be toxic. Till the moment we didn't test it as a biological. And I'd like to thank you for your listening and patience.
So many questions.
So when you exposed the compound to HCl, did you use concentrated HCl or what concentration?
2 molar HCl.
2 molar
Yeah, 2
HCl?
molar with about heating with about 80 degrees Celsius for about 3 hours.
For 3 hours?
Yeah.
And so the decarboxylation occurs then without heating?
No. Actually, we didn't separate the intermediate.
Okay,
Okay. I take the milk acid
yeah,
just for CO2
yeah.
and in one point reaction, decarboxylation was occurred.
Thank you.
So I have a question. You use 40 degrees Celsius, correct? You mentioned the temperature that you use.
Yeah.
So what's the rationale for using that temperature?
Okay.
I'm not a chemist, so
Okay. It's actually analysis. When you register your product, okay, here in Mr. Health, you have to put your first product under 2 conditions. Okay. Under 40 degree and 75 humidity, and another condition is 25 degrees Celsius with 60% relative humidity. For 3 years. Yeah, for 3 years. And you have to show that under this condition, there are no any degradants above their limits. Accelerated.
yeah. Oh, well, interesting.
Yeah.
Because this is
Yes, FDA, Jordan.
Jordan.
Yeah.
Do we have the same thing in state?
And actually,
No, I'm pharmacologist, so I
actually,
send
actually, I think
Interesting.
more information because this is relatively confidential. And except this part, I can put this. Otherwise,
at least I learned today, you know. Go ahead.
actually, I can't.
Just to add, in Jordan we asked for the real-time stability study to be done on 30 degrees Celsius and 65% relative humidity. Because we here in Jordan are classified as zone 4A, so we have higher temperatures and humidity, just to add for our manufacturers and those who want to register in Jordan. While in zone 1 and 2, it is accepted to have 25 and 60%.
So zone 1 and 2 is like what?
Europe, because they have
the temperature.
Yeah.
Actually,
But in Arizona, that's zone 4.
the verify this point is actually in Jordan.
Okay, go ahead.
Most of the pharmaceutical companies, they don't depend on the local market. They want to cover all the zones, 1, 2, 3.
Right.
So they cover the Jordan market and for Saudi Arabia and for Europe and for USA. So most of the pharmaceutical, they put their samples under various conditions because the local market here actually is narrow.
Very important.
Thank you very much.
Okay, so yeah, thank you very much.
Okay, our last talk and our last speaker will be Dr. Dima Sabah. Dr. Dima is an assistant professor of medicinal chemistry and drug design at Faculty of Pharmacy at Zaytuna University, and the title of her speech will be From Head to Lead, Structure-Based Drug Design, Synthesis and Biological Evaluation of Novel Benzoyl Derivatives as PI3K-alpha inhibitors. Dr. Dima earned her baccalaureate degree in pharmacy from University of Jordan in 1996. She worked as teaching assistant at the Zaytuna University College of Pharmacy, and she has her master's degree in pharmaceutical sciences from the University of Jordan on 2003. And she got a lecturer position at the Zaytuna University, then earned her PhD in pharmaceutical sciences, computational chemistry, and drug design from the University of Nebraska Medical Center in 2012. Her research field mainly focused on computer-aided drug design software to explore protein structure and to design ligand complemented with medicinal chemistry. Okay, more than yes.
Thank you everybody for staying till the last minutes to hear my talk. Actually, it will be a brief summary of what's going on in my lab, the computational chemistry lab, and even in the medicinal chemistry lab. In this story, I will talk a little bit how we jump from hit to lead using structure-based drug design. We investigate the binding pockets of the kinase alpha in order to modify or even change the functional group of this hit, targeting the cancer, mainly colon cancer. All of us, or mainly all nowadays, the kinases, they are the good target for cancer treatments. Why? Because the phosphatidylcholine kinase is responsible for phosphorylation of the 3-hydroxyl moiety of this anticoagulant, forming the triphosphate molecule. This molecule, which activates the downstream proteins such as mTOR and APT, altogether that they activate the cell proliferation, cell division, and control mechanism of this pathway into cancer. So the main point that we have many isoforms in our body. So which one is oncogenic? So we can speak a little bit about the main functions of these isoforms. All of them, they have function and structure. Only the alpha isoform has been connected to cancer. Why? Because it's responsible for proliferation and cell division. So how we can target specifically this protein without damaging the others, which they are beneficial to our bodies. So it was noted that PI3K alpha may be overexpressed or activated or mutated in different types of cancer. And also there is a good connection between sex and cancer. For the female, there is, for example, breast cancer and even colon cancer. For male, there is prostate cancer. For both of them, they have brain cancer. In this method, particularly what we use, we build a pharmacophore model, and what I mean by pharmacophore is the ID for, or even the fingerprint of this enzyme inhibitor. How we can identify that this ligand is particularly can bind to this protein if we identify these functional groups. So we build this pharmacophore model in order to identify which functional group could be recognized as the binding site for this and activity. We find that to be PI3K alpha inhibitor, which should harbor three chromatic rings, one has to be controller and one has to be acceptor. Then we downloaded the National Cancer Institute database having 26,000 molecules. And we are lucky that we retrieved around 33,000 molecules reported as this and fit this pharmacophore. And we are very lucky that we have benzoin as a hit. The beauty of benzoin is cheap, available everywhere. It's used in cosmetics and also as antibacterial agents. So how we can jump from antibacterial and cosmetics agents to anti-cancer compounds. So we found also that the parametoxybenzone also is available in market. So we purchased both with these two compounds, and in order to investigate whether this hydroxyl group is important for activity or not, we hypothesize that functionalization of this OH group may, may produce certain inhibitors or not against PI3K alpha. Then we started our adventure against this design, and we esterified this hydroxyl group using activated chloride derivative, forming ester derivative, and also particularly using certain derivatives with orthomate beta para in order to investigate their binding interaction, and also we use R groups such as electron donating and electron withdrawing group in order to investigate their activity. And also we functionalize the methoxy derivatives, okay, and forming this only derivatives. And nowadays what we are doing, we also functionalize this hydroxyl moieties with different derivatives, and also a little bit work how we can jump from ester to sulfonamide to imine in order to target this enzyme particularly. Fortunately, these compounds were found to inhibit the human colon cancer cell line, which overexpress the PI3K alpha. And we have somehow moderate activity against this enzyme, particularly that this shows that these compounds, they have the affinity to bind to the binding domain of this enzyme, and also they are able to inhibit this enzyme to a certain range. And also, in order to investigate whether these compounds can induce apoptosis or not, we studied the activities against caspase enzymes. So we found that these enzymes induce the activity of caspase enzymes, and this is a hallmark for apoptosis. So we have two indications that these compounds may be anti-cancer, like inhibition of this cell line and even induce apoptosis. And in order to identify the structural basis of binding of these compounds to the binding domain, we use the glide dock methods in Maestro, which is one of the Schrodinger softwares. We found that all these compounds accommodate the kinase domain, and also this is another proof that these compounds are kinase inhibitors. And also we found that the majority of them, they bind to the certain key binding residues which they were observed in previous publications, that they are the key binding interactions. And we have found that the majority of these compounds either binds to valine 851 or lysine, and both of them, they are important for interaction. And in this figure, we show that how we have different binding modes in the kinase domain, so such that the aromatic, they have 5-5 interactions with the aromatic ring of the tyrosine enzyme, and how we have hydrogen bond interaction between the lysine and the oxygen of the benzoin derivatives. And also here showing the both hydrogen bonding interaction with valine and lysine. And in order to validate our docking methods, what we did, we superposed the dock pose of the already LY294, this inhibitor which is none in clinics, to the dock pose to the needed conformation, and we found that these compounds, they are all superposed with the root mean square deviation, which is less than 0.01. That means that our glide dock is capable to identify the binding conformation, and also it can be used in order to predict somehow the biological activity before starting synthesis, in order somehow to save the economics and also to save solvents before starting synthesis. And what we found that the benzoin has been reported previously as antibacterial, as I mentioned before, or even as anti-cancer compounds. We have we agreed with some publications that it has that the hydroxyl position at or para position is important for anti-cancer activity. In addition to the analgesic and anti-inflammatory activity in mice models. So how we recruit both methods. We recruit the ligand-based ligand-based drug design. We build the pharmacophore model, and then we jump to the structural-based model in order to investigate the binding side. We recruit both of them, and we functionalize the benzoin, having different derivatives targeting PI3K alpha. And we found that these compounds, they have anti-cancer activity, induce apoptosis. Okay. And this work was published recently by Organic Medicam, And I would like to thank the University of Jordan for the NMR facilities and also for the bioassays, and also our thanks to the Deanship of Azaytuna University for supporting our research, and I'm happy to answer any questions. Thank you.
Any question?
No, your compound has a chiral center, you can have two enantiomers. Is it one particular enantiomer that's active or?
What we did, I did looking for both, for the R enantiomer and the S enantiomer. And I found that both of them, they have the predicted binding affinity. So, but because Benzone is available in market, it has both enantiomer, the R and S. Up to this step, we didn't spread or even isolate the enantiomers to get even which one is more active, the R or S. But somehow the predictive activity or the binding activity shows similar, because what we did, we mapped it against the pharmacophore using different enantiomers, and we found all these functional groups either from the two sides fit the same functionalities.
Other question is, we have a nitro group in the active molecule.
Yeah.
And nitro groups are not particularly good for drug molecules.
Yes.
So you had planned to replace it with other.
For this we select this molecule because for the nitric oxide and even for the it's toxic and it could be reduced to amine and monocovalent bonds. So the toxicity of the nitro and even all anti-cancer compounds, they have nitro groups for better activity.
Is there any other question? Okay, thank you, Dr. Adima. Just I want to announce that the closing ceremony will be in Jarash at dinner, so there's no closing ceremony here, and for the certificates also they will be distributed there, and for whom that will not attend the dinner, we can send them their certificates, and the bus will leave from Ibis Hotel at 7 o'clock toward Jarash. So, see you.